So now that we have identified where we can improve in our system, we are going to run a PDSA cycle, which is another way to say we are testing a change. In this PDSA cycle, we will develop a plan to test the change, plan, carry out the test, do, observe, analyze, and learn from the test, study, and determine what modifications, if any, to make for the next cycle, act. Our objective is to test having nurses wear a sash indicating they are preparing and administering medications and having the electronic medical record system require flushes for IV medications to be scanned in the EMR with a small group of nurses in hopes of improving medication administration safety. 3 RNs will test using the do not interrupt sash and new scanning methods with the last medication administration rounds. Some questions we have is, will other patients need to be addressed while the RN is not to be interrupted? Will it be effective? Compliance comes from not only the nurse wearing the advisory, but also other staff that sees it. And what are some negative consequences that can come from this? Our plan for collecting data is each RN will write a brief paragraph about their experience using the do not interrupt sash and EMR flush scanning process, highlighting what they noticed about their med admin process. For our do part, we are going to run the test on a small scale. Describe what happened, what data did we collect, and what observations did we make. 3 RNs attempted the new medication administration routine during the last medication round on Monday during day shift. RN1 found that there were less interruptions during med preparation and administration and was able to work efficiently. Nothing was different for IV medications other than having to scan another item into the EMR. Now we're going to summarize and reflect on what we learned. We had 3 predictions, starting with, we will have to prepare all the staff for this change and have an aim for patient safety as a team, so we have total compliance not only from the RNs but from other hospital staff as well. We will need guidelines for when it is appropriate to interrupt medication administration. And we will need to outline an action plan for messages that need to be conveyed to an RN for when she returns from medication administration. In addition to the team confirming the predictions, the RN realized the guidelines for CNAs need to be more clear surrounding information, such as patient vitals. Now we're going to determine what modifications we are going to make, adopt, adapt, or abandon. The RNs plan on using the sash when starting from when they begin to prepare medication to when they administer it. The other staff will work on critically thinking about what is urgent enough to approach the RN while they are preparing and administering medications. As far as the system goes, the new requirement to scan all flushes with medications will be left in place as it is an error prevention method and ensures correct IV medication administration.